It would have to go live. Hi guys, welcome back to my channel. I'm Dr. Sylvia. I'm a GP and health educator based in the United Kingdom. I'm so pleased to see you here today. We have got a treat, a lovely basket of amazing questions that you all have sent in to me throughout the week and I've fished out from different areas. So we're just going to dive into these questions, just checking my audio there. Everything is going fine. Thank you so much for joining, whether you're on Facebook or YouTube or LinkedIn. Please let me know where you're watching from, what part of the world you're watching from. And of course, do give this video a like. And of course, if you like what we're doing, consider subscribing to the channel. So we're going to be tackling health questions. And let me just show you a preview of what we have in store for a second. And so what we're going to be doing, oh, am I getting some trouble with, oh, hang on. Is there a problem with something playing? Oh, I hope you can see this now. So we have on this episode, we're going to be looking at skin tags and diabetes, vulval lumps and bumps, natural fibroid treatment, menstrual clots, breakthrough bleeding, BTB on the pill, on the birth control pill. And then we're going to take a deep dive into a laparoscopy report that I found. It was a really interesting conversation I found on a public forum. I'm going to be sharing it with you. I thought it would be very, very educational to go through this. So let me know what you guys think. Let me know if there's any of these topics that particularly stands out to you. To be great to know. Before we carry on, though, let me just issue my usual disclaimer. Please take a moment to have a look at it. For some reason, I'm having delays in setting up my YouTube. Anyway, it looks like it's working fine. Let me know if you guys have any issues. Let me know in the comments if you have any problems seeing something that I'm referring to. So just a quick reminder that we are doing this for educational purposes, not intended to replace your own doctor's professional medical advice, diagnosis, or treatment. Okay, so please always visit your medical team who know you, who can examine you, who you're registered with, because they're in the best, very, very best position to be able to give you the guidance, the assessment, everything that you need. We're here to help to unpack jargon, dispel misinformation, share medical knowledge, have conversations about things, but by no means can we replace your medical practitioner. So with all that out of the way, let us just dive into the very first question. I'm going to be sharing my screen, sharing the questions as we go along so that you can read along as I do that. So the very first one, for those who are watching, okay, I've got this up, so hopefully you can see this. Let me just switch the QR code that you can see at the top there, so hopefully you can read the question. Actually, it's not actually blocking too many things. I think you can see it fine. All right, so this is the very first question, and I thought it's good to start with this one because it just struck me. It really struck me, just how sometimes the concerns that we have, if whether it's instinct, whether it's, if you think, oh, I'm being unduly worried, please always go and check it out. Always go and have a discussion with your medical doctor. Don't put it aside. Don't put it off. Please do that. In fact, let me just mention here, in the UK, I'm sure those of you who live here will be aware of the news that Lord David Cameron, our former Prime Minister, disclosed, I think it was this morning, that he was diagnosed with prostate cancer earlier in the year. He's 59 years old, so that doesn't, that's not a surprise to me given the age of this condition. I think what resonated with me was he said that it was his wife who badgered him. Obviously, he didn't go into too many details, but what hit me was that his wife made him go and take this appointment, go and do your screening test. And that was how he got diagnosed. Because traditionally, or I don't know, culturally, men seem to take these things not as important. They put off going to the doctors. And a prostate cancer screening test is fairly, compared to a late diagnosis, the prostate cancer screening test is a very, very little price to pay, and we should have more of it. In fact, we're having conversations about whether it should be offered earlier to men in the UK. And all it includes is having a blood test to look at your PSA, prostate-specific antigen, and then there might be an examination as well in the rectum to explore the prostate. And if any abnormalities or concerns are raised, then a referral to a specialist to assess further, do scans and so on. I think that's a small price to pay to be able to know, oh, I'm in the clear or I'm not. Please don't forget that research tells us that Black men have a higher risk of developing prostate cancer. So there's a video on my channel. I think I linked it in a community post earlier. I know I'm digressing, but it just popped into my head, and I wanted to make sure that this is something that we talk about. So please, if you're somebody who's not thought about it, or you're thinking about it, or maybe because I've mentioned, you think, oh, actually, maybe I should, sort of in that age, 40 upwards, you have a man or your husband's partner, uncles, dads, brothers, and so on, tell them, go and have this conversation with your doctor, get your prostate checked out, get your PSA checked, get a prostate screening. But why did I get there? I got there because of this comment that somebody sent in, or this question that somebody sent in. So we're going to be looking at vulval lumps and bumps. I'm going to talk about a few of them, but I really want to narrow it down because I know that we say, oh, rarely vulval cancer, but it is something that could happen. So this is a question, this is a comment that somebody sent in to me. A friend just had a cyst on her clitoris, went to get it checked, and they told her it was a tumor and cancerous. It was removed and 2 stitches. I presume she means she had 2 stitches. I'm not very sure. This is what she sent. So the question that she was asking, or that this person is asking, is, I'm not sure how they could tell her that same day it was cancerous. They sent it away after removing it, so not sure what the results will be. Thank you so much for sending in this question. Let me take it off so I can look at you. Thank you so much for sending in this question. I appreciate your candor and I appreciate your curiosity. I'm always grateful to you guys that send in questions. We are asking, we help. We want to hear the questions because we want to help to break them down, make them understandable. And I understand the concerns that you have here. I think I will say, without obviously knowing any more about the symptoms that your friend had, because you say, oh, she just had a cyst on her clitoris. I would love to know what the symptoms were. I'd love to know, how big was this cyst? How long has she had it? Was it doing anything else? Maybe it is itchy. Maybe it was bleeding. Because if those things, if those symptoms or signs are there, the doctor may feel that this is probably going to be this. They cannot give a definitive diagnosis. That is the reason, obviously, that she's gone to have have it removed, and then they've sent it off for testing. So this will be in the laboratory, in the hospital laboratory. They're going to be looking at the tissue and the cell, whatever fluid that they got out of it. They're going to be exploring it to determine whether it has any features of cancer, to give you a confirmatory diagnosis. But actually, there are certain symptoms or signs that might indicate, perhaps even the appearance of this cyst, because all you know, or all you've told me is that it's a cyst. I don't know anything else. So your question, and I appreciate that question, I think it's a valid question. How could they just tell, just after taking it out, how could they tell the same day that it was cancerous? I think that's a reasonable question, but I wonder whether it may be from its appearance and perhaps the symptoms that she's had alongside, maybe her family history, maybe she's had something like this before. We don't know. So those are the things that could make this a situation where they have informed her that there may be a chance of cancer. And of course, we weren't in the room. We don't really know the conversation. The bottom line is we're waiting for the definitive results. And it's a difficult time, because clearly people will be worried, will be concerned about things. But why have I brought this up? I brought this up because, oh, something's blinking in the room. My light has been blinking. It doesn't happen any other time apart from when I'm doing a live stream. Behave yourself. Okay, so why have I brought this up? Because I want us to talk about vulval lumps, to explain to you that vulval lumps are very, very common, ladies. They're very, very common, and they can cause a lot of anxiety. And it's important that any new lump is checked out by your doctor, especially if it's persisting more than a couple of days. So that might be 2 or 3 days, or if it's getting bigger, it has other symptoms like pain, or there's a discharge, it's hot, and so on. Most of the time, they're benign. And when I say benign, they're not cancerous. They're not going to spread and invade to other tissues and lead to loss of life. Most of the time, they are benign and treatable. And it's important that you seek medical advice, because even though the vulval cancer is rare, it's important that it's picked up early so that you can get the best treatment available. One of the more common types of, should we say, benign lumps, and I say that advisedly because I know many, many women suffer from what we call baffling cysts or abscesses, and they probably would raise an eyebrow at me calling it benign. Well, you will understand that compared to cancer, that's what I mean. They're very, very, if it's a Bartholin's abscess, very, very uncomfortable. If it's one that's recurring and coming back and you've been dealing with it for months and years, I understand. Very, very uncomfortable, tricky condition. But if we're talking about a sort of simple cyst, a Bartholin's cyst, the Bartholin's glands are two glands that are on either side of the vaginal opening. I haven't got my model here with me at the moment. And what they do is they produce fluid that goes into the vagina to lubricate it, okay? And sometimes if the duct, that is the tube, the channel that leads from the gland into the vagina gets blocked, you could get a cyst. A cyst is just a sac anywhere in the body that just starts to get bigger and sometimes gets filled with fluid. If there's backed up fluid, if germs enter in, it could get infected, and that is how we enter into the realm of a Bartholin's abscess. So the cyst can actually stay there for weeks or days, or, you know, well, when I say, yeah, it can stay there for some time and just do nothing, might just be a tiny size, not really doing anything. And in which case you may not necessarily have to worry about it, but you just keep an eye on it after your doctor has checked and confirmed what it is. Sometimes you could use things like a sitz bath if it's a sort of small cyst and it might be causing a bit of discomfort. That could be one, you know, home treatment that you could do. When it gets beyond the level of severe pain, you can hardly walk or sit, or you're actually getting a fever, feeling ill with it, that is a hospital job. That is not, or that is your doctor's job. That is not something to deal with at home. Okay, so a Bartholin's cyst is one example of a vulval lump that is, you know, like we say, is benign. So that you know, you should be aware of. Something else that could happen in the vulval area that some people can experience is called an ingrown hair. And yes, just as you can have an ingrown hair anywhere else, you could also get it in the vulval area, because of course the mons pubis is the hair. So an ingrown hair is basically an inflammation of the follicle, or folliculitis. So this is very common for those of us who shave or wax or pluck. The hair curls back into the skin and then it creates a small red lump, a tender bump. Might look like a pimple. Sometimes it could look as if it's filled with pus as well. There are other types of cysts called sebaceous cysts, which are sort of very small and they grow very slowly. They are not cancer. Like I said, these are benign causes. They're sort of filled with oil. So these are skin gland kind of cysts. They're usually painless. And sometimes if you try and move them, they may just move a little bit underneath the skin. Again, I'm not asking you to be diagnosing yourself, but I'm just telling you that there are potentially a number of things that could cause a lump in the vulva. And if one happens, don't sit down wondering, oh, is it this or the other? If it's something that is getting bigger, not going away after a couple of days, it's time to speak to your doctor. So that was the sebaceous cyst I just mentioned. There's also things like vulvar varicosities. I think I have a couple of videos where I deal with this. More common in pregnancy, where you have the size of the bump pressing on the blood vessels as your baby bump gets bigger. Some women could develop something that is similar to varicose veins, but actually happening in the vulva. And so you could have a little lump or bump. And after the baby comes out, usually it settles down completely by itself. And like I said, more common when a woman is pregnant. There are also things like genital warts. Those are also very common causes of lumps or bumps in the genital area, both in men and women. Of course, here we're talking about vulval lumps. So this is in the vulval area, caused by the HPV strain, the low risk HPV strain. So they usually look like the color of your flesh. They can grow to different sizes, different shapes. They could look like skin tags, which is another cause of lump in the vulval area. And they are a sexually transmitted infection, but they are treatable, okay? And of course, I will end with saying that less common but serious things like vulval cancer. So a vulval cancer or a lump that could be cancer in the vulva, we're talking about something that is maybe sore, so it might be tender, it may not go away after a period of time. It might be getting bigger, it might be very itchy, it might bleed when you rub at it, and it might just open up and just weep. When I say weep, that's bringing out a bit of fluid or pus, and it doesn't get better. These are some symptoms, but I'm not saying they are the only symptoms. What I am saying is that it is important to seek medical advice if at all you have concerns about this. All right, guys, so this was dealing with vulval lumps or bumps, prompted by this question that we got from my viewer, who talked about a friend who just developed a cyst and was wondering, oh, how did they quickly know it was cancer when they haven't even tested it? And the point I was trying to make was that it is possible depending on the symptoms that it presents with, and why it's important for us to get in touch with our doctor. Don't try to self-diagnose or self-medicate. Yes, there are many different possible causes, and I've listed a few of them just in the last few moments, but it's always important that you go and seek medical advice so somebody can examine you and arrange tests and so on as needed. Thank you so much. Excellent. Guys, give this video a like. I hope you're finding this information useful. If you have any questions or you want to make any comments, let me just have a quick look. If you want to make any comments on the topics that we're discussing today, you're very much welcome. I'm happy to hear from you. So let's move swiftly on. We've got a few topics like I showed you at the beginning. We've got 6 to get through. The very next one that I would like to share with you, let me see if I can pull this up. Where is it? Let me see. Yeah, it's this one, which came from a concerned mom. I think I'm just going to move this QR code. For those of you who are wondering about the QR code, I'm really very happy to share with you that it is the code for your gpconsultation.org. Let me move this away so I can look at you for a moment. Give me a second, guys. That is the QR code for your gpconsultation.com. This is a private online consultation service for women and for sexual and reproductive health that I founded here in the United Kingdom, meant for UK UK-based residents. If you are wanting a GP with a special interest in women's health and sexual health to provide you guidance, advice, treatment, as long as you're a UK resident, because this service is regulated by the Care Quality Commission. Links for how you can book an appointment in the description box, or just use the QR code and you'll book an appointment with me or one of my colleagues. Will be really happy to provide you the service. Right, let us hop quickly on to the very next question. So, hi, hello, and thank you so much for sending this question. I appreciate you. My daughter is 14 years old. She's experiencing periods with little clots. What is the reason for this? Okay, so thank you so much for sending this question. I think it's often useful to talk to both moms and daughters, and I'm really glad that there's a mom here, because I think the last live stream we had a conversation about a 12-year-old, I think it was, if I remember correctly, who didn't want to disclose the presence of a vulval lump to her mom. But here we are with a mom who is very much invested and interested in something. I love that that relationship that that you have with your daughter and asking this question. So thank you so much for bringing it for us to have a conversation around. It's not uncommon. It's not uncommon that you can have small, occasional blood clots. Blood clots are not unusual, okay? So the menstrual flow contains blood and tissue coming away from the lining of the womb when this cycle, or the last cycle of reproductive activity, the ovulated egg was not fertilized. So the body is going to get rid of any material that was not used, plus dead material. This is nature's way of removing all that material and then preparing for the next cycle. So you will have menstrual blood that's made up of tissue and made up of blood that comes away from the lining of the womb, okay? So our body also releases anticoagulants, okay? Anticoagulants are chemicals or substances that prevent clotting, and our body does this in order to keep this flow liquid. But sometimes if the flow is heavy or fast, the anticoagulants, they don't have enough time. That's your body's natural anticoagulants don't have enough time to work, and so blood pools in the vagina before it's pushed out as period, and this allows it to clot. It's usually very common the first day of the cycle when there's a lot that the body is trying to get out, okay? That's when you might commonly experience this, this phenomenon or this condition. So small clots are quite common. It might be the size of a 5p piece, or I think that would be the size of a dime in the United States, size of a peanut or cashew nut. So I'm not expecting anything bigger than that. But if you're asking me this question, because little is subjective, isn't it? How little is little? I don't know. what your little is, but I've given you examples of what I consider little, because I want to say that if you're experiencing larger sized clots, so we're talking about clots that are bigger than a £1 coin, for example, or passing plenty of, those clots. So a £1 coin, a quarter in the United States, if you're passing, or if she's passing a lot of that size of clots, or soaking her menstrual product, her pad or her tampon every 1 or 2 hours for several hours in a row on that day, if her period is long, prolonged, lasting more than 7 days, if she's unwell, because I think sometimes you forget to mention that if she's not well, if she's complaining of feeling very tired, she wakes up after what you think is a good night's rest, but she's tired. Oh, I feel tired. I feel like going to school. Or if she's having, if she's feeling dizzy or complaining of feeling dizzy, or God forbid, faint episode in school, or she's having pain, pelvic pain, during the periods or even after the periods, that doesn't get better, if it's severe, and if it doesn't get better after using, standard painkillers that you can get over the counter, paracetamol or ibuprofen and so on. If any of that is going on, then you have to speak. You have to take her to the doctor. You need to sit down and have a conversation about this. I will say, okay, that for a 14-year-old who's probably, started her menstrual cycles maybe in the last couple of years, she's still establishing a pattern. I would expect some imbalances. That would not surprise me. By the time she's a bit older, then her pattern will be established, and I would expect that to be normal. So this is my thinking around this. I don't want you to panic. I don't want you to be concerned. But I do have further questions, and I think you need to explore how large are the clots. Are there any other symptoms that she's experiencing with them? If that's the case, then please speak to your doctor. I always recommend that ladies, and we tell our daughters, we teach our daughters about keeping a record of our menstrual cycles, whether we're using an app or we're just using our notepad on the phone or whatever it is that you want to use. Keep track of the dates, keep track of how heavy it is, how long it lasts, and so on. Useful information that we doctors can use to identify a pattern if anything comes up. Okay, I think we tackled that question in a reasonable way. Guys, thank you so much for watching. Please give the video a like. Let us take a quick break. I am taking questions live, so if you have questions related to fibroids, women's health issues, sexual health, let me know. But let's take a quick break now, I think, and I will be back with you in a short while. Feeling unwell but dreading the wait for a doctor's appointment? We get it. Life doesn't stop for health concerns, and neither should you. Your GP consultation connects you to licensed healthcare professionals from the comfort of your own home. No waiting rooms, no hassle. Discuss symptoms, get advice, or manage ongoing care, all through secure video calls and chat. It's healthcare that fits your schedule. From hormonal balance to menstrual health, thyroid concerns, or menopause care, our GPs are here to listen. Get personalized, discreet care that's tailored to your needs. Whether it's a minor illness or just a question that you've got, we're here to help you. And we're back. Thank you so much for joining me on today's live. We are tackling a few different topics. We've just covered skin tags and we've just covered vulval lumps and bumps, and we've talked about menstrual clots. You can see I'm not going in any particular order. I'm just sort of pulling them up as they occur to me. So what I'd like us to look at now is natural fibroid treatment. And this is not really a question. Hang on, let me look at you guys again first. So this didn't really come as a question. I'm going to read out the comment, but it set me thinking, actually, because I have lots of ladies who come and talk to me about fibroids, both those who absolutely want or support natural treatment, and those who are exploring non-medical treatments of the orthodox treatment. And everyone in between. I get comments and questions from both. So this was interesting when I saw it, and I just thought, for somebody who has gone through her journey, I'd like to share. So let me read out her question before I sort of talk about what it is that she was saying. So this is a comment, and thank you so much to whoever posted the question. I really appreciate you. You said, for years, you've been trying natural, and you said it was taking all my nutrients. fasting, supplementing. Laparoscopic surgery was my only solution. Very happy I finally did it. That was the comment. That was the comment. I thought, whoa, because I don't really get that many coming to report that they did natural and it didn't end up okay for them, and so they had to go down the route of surgery. I think the important thing is that you are well. I think the important thing is that you're happy. I think the important thing is that you've got the quality of life that you deserve. But I want to use this opportunity now to address natural fibroid treatments, okay? And I'm not by any means trying to take away anyone's right to advocate for themselves or choose what treatment you prefer for your own body. My job is to provide the different options that we have, both natural and medical or surgical, with the evidence around it as we have in the world today. So natural treatment is popular. What I'm really keen about is, if you want to go down the natural route, please ask the right questions. That's my purpose. That's what I'm interested in. Please ask the right questions, because my worry is that people don't ask the right questions. The person who sent in this question, she said for years she's been trying natural. And that was what struck me. For years, she's been trying natural. She was doing fasting, she was doing supplements, she did everything, and time was going. Time was going until she decided, you know what, done, enough, laparoscopic surgery, and then she was happy. How much earlier could she have gotten the quality of life that she deserved, that she needed? I don't know. So before you want to go into natural fibroid care, please ask yourself, I would recommend you ask yourself these questions. I have a video on the subject as well, but let's just quickly talk about it in this context. First, know or ask your surgeon, your doctor, what is the exact size, number, and location of my fibroids? How big are my fibroids? Where are they? How many do I have? Why am I asking you to ask this question? Because all women with fibroids do not have exactly the same type, size, number, location, and so on of fibroids. They don't even have the same symptoms. If you remember, if you study fibroids with me, if you've gone through my videos, you know that women with fibroids, you can't just put them all in one basket. There's some that don't even have symptoms, all the way to those that have really severe symptoms. There are women who have fibroids, they don't even know about it. And they get pregnant, no questions asked, nothing. But then there are women with fibroids who are struggling with fertility. So that's what I mean by that, by the fact that you can't just put everybody in the same basket. You need to ask, what is the type of fibroid you have? How big is it? Where is it located? How many do you have, and so on? Because that can to some extent explain the symptoms. For example, if you have what we call submucosal fibroids, the ones that are sitting within the lining of the womb, okay, they are more likely to cause heavy bleeding and more likely to have an impact, potential impact on fertility. While the ones that are sort of sitting on the outer wall of the womb are the ones that are more likely to push against your other organs, like your bladder or the bowels, cause problems like constipation, trouble passing urine, or pelvic pain, nerve pain, back pain, and so on. So these features, the size, location, they directly impact symptoms, and they can affect, or they can determine which treatment is most beneficial or successful for you. So the point I'm trying to make is that knowing this information can help that decision quicker. So you're not wasting time pursuing something that's not really making any difference, and then waiting years before you get the quality of life. And usually, to be able to answer that question is via an ultrasound or MRI that your doctor has arranged for you to see clearly what is going on. Number two question: how are my fibroids likely to behave based on my age and health profile? So this is a bit of a tricky question, because we're still learning so much about fibroids, but I think it's worthwhile having that conversation, because your doctor might say, well, it depends, but at least you have an idea. Now, fibroids, we know, are hormone sensitive, estrogen sensitive. So they would often grow in our reproductive years, okay? That's when we see fibroids mostly growing. That said, there are women who get to menopause when estrogen levels are supposed to be dropping, but fibroids are still persisting. That's what I mean that we don't know everything about fibroids. We expect in the most that as you enter menopause and the estrogen drops, the effect of fibroids starts to diminish, but that's not what we're seeing. Some women do not have that experience. But understanding this, your doctor might, and depending on your age, your doctor might say, look, if it's not causing any problem now, just observe it. Or they might say, given that these are your symptoms or this, then perhaps there's some natural treatment that could help depending on your symptoms, okay? The next, number 3 question is, this natural treatment you're considering, what is the scientific evidence? I'm really sorry that we're at a place or a stage in I don't know, in our culture or society where there's less confidence in research, in tests and asking questions, because that's really what, if you boil research down, that's what it is. You want to see, does this work? How does it work? What in a controlled situation, can I apply this particular test or medicine to somebody else and it would work? So it's not just an anecdotal, story. Oh, my grandmother did this and it worked. Oh, therefore it must work for you. It's in a controlled format. You're applying different conditions to test this thing, this drug or this particular intervention, to be sure that wherever you apply it, it will give us the same result. That's usually, that's the question that research is asking. And it's a positive thing. It's a beneficial thing for our world to ask these questions, to learn more and to know more. But I think, and again, we're talking about misinformation, aren't we? I think that this is one of the things that having fake news has really, really tried to dispel and attack, and we have to push back. And look at, it's good to shine our eyes on research, on data, who is funding it, and make sure that there are no undisclosed interests and so on. I completely take that on board. But it's like throwing away the baby with the bathwater. If you refuse, you just completely give up on research. It's important. So that's why my third question I say is, what is the evidence? Okay, because we haven't fully regulated the term natural in many, many parts of the world. Ask for the evidence. Okay, because if somebody says, oh, it's something that I did, I drank this liquid or I drank this combination of fruits and my fibroids went, I don't know what and what. I don't have any positive things to say about that report if it's just one person sharing their experience. I'm not taking away from their experience, but before I apply it to a whole other group of women with fibroids, it would need to go through some rigorous testing. Okay, so this research I'm talking about has suggested that eating less red meat and having a diet that is high in green vegetables, fiber, can help to manage and reduce the risk of fibroids. It's told us that people with low vitamin D has been linked to fibroids growing. Okay, it's also told us that taking vitamin D with supplement like green tea extract, EGCG, has shown some promise in helping to reduce fibroid size for some women and some types of fibroids, and even help with some bleeding. That's what some research has shown. Acupuncture as well is a natural treatment that has provided benefits for some women, not everybody. So I think it's important that you're asking, where is this? Where have they tested this? Based on what information is this? How reputable is the source of the studies? Dig a little bit deeper when you come across these natural studies. And please, we are not your enemies. Your doctor wants you to get better. We welcome you to ask these questions. Because then we can, even if we don't know the answer. There's sometimes that patients come to me and ask me questions. I don't know the answer. I don't know everything, but I'll go away and find, where can I get the answer? And with my training, I'm probably likely to find a source where I can get information that is reputable, because I'm working in the NHS. We are using evidence-based methods and treatment. And other countries have their own different systems, but I'm just referencing mine and saying that at least I can go and find this information and provide you the guidance that you need. So that's a really important question to ask. And the last question, and one that I often find is disregarded. I marvel at how do you not monitor? So the question is, how will you monitor? And what is the definition of success? If you choose to go on an alkaline diet to manage fibroids, and I'm not recommending that by any means, I just threw that out as an example. Will you not check after 6 months or after 12 months? What is the effect? So there has to be an established way, and there should even be a timeline, I beg to suggest, on how long you want to use that and what you count as successful. Is it less bleeding? Is it that you fall pregnant? Is it less pain, pelvic pain or pressure? is it on your scans, you're seeing the size of the fibroid actually shrinking? Really useful to set clear goals that you can measure, a timeline to reevaluate. Don't run away. Like I said, your doctors are not your enemies, okay? So I want to say, again, we're responding to this comment that came into my channel around natural fibroids treatment. And I found it wasn't a question, it was simply a declaration. She said, for years, I've been trying natural. I was taking all my nutrients, I was fasting, and I was supplementing. And then she paused. Laparoscopic surgery was my only solution. Very happy I finally did it. And I thought I want to bring this up and just to say to anybody who is considering natural treatment, like I said, it's not anybody's right that to tell you how or what to do. It's your body, but our job is to make sure that we're giving you the right information so you can make the correct advice to get you to where you need to be. Okay, guys, thank you so much. Let me know your thoughts about this. If you're watching this live, watching this replay, on the replay, I would welcome your contribution to this. I know it's a hotly debated topic or subject, and I see that on my videos, conversations. I see that on other people who share videos on this subject. And yeah, I think it's interesting. It's interesting. Okay, thank you so much. Are you guys liking the video? Are you liking the video or not? Wait, it doesn't cost anything. Just click click that thumb and you like the video. I'd really appreciate that. It goes a long way to show YouTube that we're doing some good work here, and I know that's what we're doing. Right, let us carry on. We're doing our deep dive, going to the deep dive segment. So let's just swap, because I'm going to share my screen with you in a moment. I found this was so interesting and intriguing when I came across this situation I'm going to share with you. And I felt there was so much to learn. And I want to say thank you, because I think sometimes you go on forums and there's a whole lot of conversation going on. Sometimes the conversation is healthy, sometimes goes a bit in a different direction. But sometimes people genuinely share bits and pieces and want to hold a conversation to help other people. So we're going to look at a surgical report. I came across this on a public forum. It's completely anonymous, no identifying details. And I'm just using this as an educational tool so that we can understand how we approach these reports and how we read them. So it's not anybody's medical advice, it's just looking at it. And one of the questions that this individual was asking, let me start sharing it now, just give me a second. One of the questions that this individual was concerned about was, she had this procedure. It wasn't a very long procedure. And it seems that she was told, let me start right at the beginning. Okay, so there we go. So this is the medical report. It seems she was told, or she seems she didn't get any answers. So she was, for a number of reasons, her expectations at the time she left her surgery were not met. So her questions were, this was a very short procedure. I think it was about maybe just over, maybe nearly an hour, definitely less than an hour. And so she felt, and this is somebody, so let me give you the background. Sorry. The background is that she's been experiencing pelvic pain, so chronic pelvic pain. And it's a query, do I have endometriosis? And she feels as if nothing was found, nothing was done. She feels as much in the limbo after she had the surgery as she was before she had the surgery. So she presented her report really, really very confused and just wanting some clarification. So all I want to do is just sort of go through the report line by line and just explain what was being said and then sort of come to the conclusion. Is she right to say that nothing much was found or not? Okay, so the very first thing that at the top, let me just tackle that she queried was, this surgery was less than an hour. What was the surgery? What was the surgery? You can see at the top, it describes what they did: a diagnostic laparoscopy, an endometrial biopsy, and then release of intraperitoneal adhesions was the next thing that they did. What's a diagnostic laparoscopy? A laparoscopy, different from a laparotomy. A laparoscopy is when they introduce devices or tools with a camera at the end of one tube so they can look into the abdomen or the pelvis by using very small cuts. There's not major surgery. Small cuts. Your surgeon then introduces this device that's like a telescope or a tube with a camera at the end into the space, the abdomen or the pelvis, depending on where they're looking at, and then they can visualize the space, so it's connected to monitors, and they can visualize the internal organs as they do that. So that was the first thing that they were doing. They also said they did an endometrial biopsy. And endometrial refers to the inner lining of the womb. Biopsy is that they took a little sample of tissue so they can go and analyze it, okay, to find out what is the nature of this womb lining. Is it healthy? Is it the right thickness? Is it growing cells that are abnormal? And then number 3, they said there was a release of intraperitoneal adhesions. Intraperitoneal simply means within the peritoneal cavity. That's the cavity within the abdomen. Adhesions, we're talking about scars. So when you see or hear the word adhesions, they're referring to scars, okay? So these were the 3 jobs that the surgeons or whoever was operating accomplished at this procedure. Okay, they told us that it was done under general anesthesia, which you understand. They used standard sterilization, so they made sure that all the equipment was managed to standardized guidelines, to make sure that they're preventing infection. Those are just standard industry words. And they said the cervix, which was the neck of the womb, was visualized. That is, they saw the cervix, because sometimes you could introduce the device and then you don't see the organ properly. They're telling us, no, they saw the cervix and they took hold of it with a tenaculum. Tenaculum, that when they say grasped with a tenaculum is just a surgical tool that's just used to grab hold of an object. So they said they could hold it because they wanted to explore it clearly. Okay, so hopefully you're following along with me. I'm just going to make sure I lift this up so that you can see properly. Lift it up so you can see properly. So we are on this line using a Pipelle device. Okay, so a Pipelle device, let me just quickly explain. It's also a tool that is used to collect tissue. That's all, basically. Just use a small device that they use to collect tissue, usually from the lining of the womb. So when they're talking about endometrial biopsy, is the Pipelle device that they use to collect the sample. Okay, so I've tried to explain. The surgery took a reasonable amount of time. It's not how short or how long it is, it's basically how effective. It seems as if it was a fairly straightforward. Remember, they're not performing any treatment. They are diagnosing, they're looking, they're exploring, they're just trying to see inside. And then while they're there, they'll take a sample. So 40 minutes or 45 minutes or under an hour is not too short. I think it's reasonable. And it could indicate that you have an experienced surgeon, so they're going in fairly smartly, fairly quickly, not abusing anybody. Of course, different surgeons have different levels. So if you have somebody who's done this several times, knows what they're doing, knows what they're looking for, is happy with the healthy nature of the organs that they're seeing, and can do the thing quickly, you're probably likely to come out quicker. It also speaks to the fact that it wasn't a complex situation that they were finding, because if it was a complex finding, then they probably will spend more time. So a shorter time doesn't mean that you were not treated properly. Okay, so we talked about the types of surgery, we've talked about the time of the surgery, and I've tried to explain what adhesions are. Adhesions are scar tissue. Why are they relevant? Adhesions are scar tissue, and they can cause pelvic pain. They can make organs stick together. What you want is your organs sort of rubbing against each other with some space or with some tissue in between them to demarcate. This is what you have, but they're free moving. They're not banded down by scar tissue that's tough, that doesn't allow the organ to expand or, move as it needs to. Okay, so those are the dangers of adhesions. They can result in pain. They can cause significant problems. So the fact that they found them, and as we're told at the top, they had to release them. Release means that they had to cut them. They had to release the organ. So they released the scar tissue. They are a physical finding. I think that's a significant finding for this procedure. And it may be the cause of the pain this individual is happening. But I think the question to ask is, why the adhesions? Where are the adhesions coming from? I think that would be a very juicy question to ask, actually, because adhesions could come from different things. It could come from infection, so even a type of sexually transmitted infection or pelvic inflammatory disease, PID, or previous surgery, maybe they had an ectopic pregnancy before, or some other type of surgery, even maybe appendectomy before, that has caused adhesions. So it could be caused by different things. Endometriosis as well can cause adhesions. So endometriosis, we're talking about having the lining of the womb develop outside the womb. For example, on the ovary, the fallopian tube, the outer body of the womb, within the pelvic cavity, or even the abdomen. It can even travel further outside the abdominal cavity. And when it develops in those areas, what tends to happen is that they will bleed, because their womb lining, that's the womb lining that bleeds every month at the menstrual period. Excuse me. So they can introduce inflammation in those areas, and inflammation will lead to scarring and the development of scar tissue. So that's another reason why that is important. So they could see the scar. I think it was significant and a good job that they caught it. All right. So they sent off the sample with the Pipel device. So after standard sterilization, so they're now describing, so this is, I'm sort of jumping the gun a little bit, but they're describing what they saw. So after standard sterilization, that is, they made sure that their tools were clean. They put in the optical trocar with the camera. It was introduced through the umbilicus, and then they put another one to the left side, and then they tell us what they found. It's always important to put what you find and what you don't find. Let me make this bigger. Would that help? I think it will help. Let me make this bigger. Sorry, it didn't occur to me. Okay. So it's always good they tell you what is bigger and what is present, or what they saw, what they did not see. So they said the uterine body, that's just the womb. It was normal size and structure. Tick, good. They said they found the left adnexa. The adnexa is just a word we use to refer to the organs at the side of, typically when we're discussing the womb, it's the organs beside it. So it's the ovaries, the fallopian tube, and the tissues or ligaments that support them. That's what the adnexa refers to. So on the left side, macroscopically means with my bare eyes, I didn't need a microscope. So macroscopically, they could see that the left adnexa, the ovary and the tubes looked fine. And the same for the right side organs, okay? Then they said the vesicouterine pouch. That is simply the space between the bladder and the womb. Remember that the bladder sits in front. So if you're coming from the front of a woman, from the mons pubis, the first organ that you meet is the bladder, then the womb or the uterus, then the rectum. Okay, so it's in that order. So they're talking about having looked at the womb and then the ovary and tubes. They now looked at the space in between. Those spaces are important. So the vesicouterine pouch is the one in the front between the womb and the bladder, while the Douglas pouch is the one behind between the womb and the rectum. So they look to see, oh, is anything going on there? Why? Because they're empty spaces. Well, when I say empty, they just usually wouldn't contain much, maybe a tiny bit of fluid, depending on your menstrual cycle. They're not supposed to contain massive amount. They're supposed to be just spaces. So when they are containing a significant amount of fluid or appear solid, or something is going on in there, it suggests that there's a process. There could even be sites or locations where endometriosis could sit. Okay, so they looked into these spaces and they didn't see any abnormalities. Then they're referring to the adhesions. So the adhesions, those are the scar tissue of the womb mesentery. So the womb mesentery is the tissue around the bowel. This is just the piece of tissue that holds the bowel in place, supports the bowel and the blood vessels, the nerves within the abdomen, connecting to the abdominal wall. So they saw this scar tissue of the bowel to the abdominal wall on the right and left side. And I have already said I will be interested in knowing what caused these adhesions. So you have scar tissue connecting to the bowel, and I think that's enough to cause pain. Even if it's within the abdomen, it could be referred to the pelvis. Not categorically saying this is all that explains her symptoms. We don't know. But we're saying that it is a possibility. Okay, we're nearly done with the report. Let's get to the last bit. So adhesions of the intestine to the abdominal wall on the right side were partially released, so they partially cut those ones. And they checked bleeding. Hemostasis just means bleeding. They checked bleeding and they made sure that there was no blood vessel that was busy leaking away that could cause complications after surgery. They made sure everywhere was nice and tidy, and then they closed up the sites where they had introduced the trocar, those devices with the camera and all that, and they stitched things up. Condition after surgery was good. Estimated blood loss very minimal at 20 milliliters. And they said, in terms of closing, their suspected endometriosis, they're trying to explain what could be responsible. Suspected endometriosis, severe menstrual pain. So let's stop sharing. Let's stop sharing this now and let's have a conversation. So the person who had the operation wasn't happy. They haven't answered my questions. Do I have endometriosis or not? What's going on? Totally understand. Very, very reasonable questions. Thank you so much for the like. I saw a like. It just popped up now, actually. I saw a like. Thank you so much for the like from Facebook. I appreciate that. That is from freelancer Moshe Rahman. I appreciate that. Thank you so much. Much appreciated. Guys, don't forget to give the video a like. So we've talked about the adhesions. Let's talk about the diagnosis and what next, okay? So they've gone in, they've had a look round. They didn't see any obvious endometriosis. Otherwise, they would have said, remember I said what they say and what they don't say is important. They didn't see any. But you don't have to see an endometriosis cyst before you say somebody has endometriosis. That used to be something that let us down. In fact, to some extent, I think it still lets us down. But even though we say that the gold standard or the gold standard diagnosis for endometriosis is a laparoscopy, sometimes you could do a laparoscopy and you don't immediately see any signs of endometriosis. Does that mean the person doesn't have endometriosis? We now know that the answer to that is no. So it's still possible to have the endometriosis without the cysts being obvious at laparoscopy. The other thing to note was that they took the biopsy. So we're still waiting for a biopsy result. We're waiting to see what is the sample. What does the sample tell us? There's still a high clinical suspicion because, again, you can't just say, oh, because we didn't see it, it means she doesn't have it. No, you can't do that. So I don't think this surgery was a waste of time. They clearly found adhesions. They've tackled the adhesions and they've done something to treat it. And that could potentially be causing the problem that she's having. It doesn't exclude the disease. In fact, like I said, the adhesions may even confirm that is endometriosis. If she's never had a PID, if she's never had abdominal surgery, you have to ask yourself, where are the adhesions coming from? So that can even potentially support the fact that there is a chronic process like endometriosis going on. So the next thing will be get the biopsy results to tell us what's happening with the womb lining, make sure that there is no other condition that could explain things. Obviously, she needs to go back with this kind of questions. It's good to go back to your doctor, good to go back to your surgeon to have a conversation about it. Hi to you. Hi to you. Thank you so much for liking the video. I appreciate that. Go back to your doctor to have a conversation. And there could be room to talk about treatment because many doctors might decide to go ahead with medical treatment, hormone treatment, if dealing with the adhesions alone didn't do anything for the pain. And again, I think the other benefit of this test is the fact that it also tells you that your symptoms are not imagined, because I think one of the frustrating things is because pain is something that we can't, you can't objectify it. You can't measure it. I mean, yes, you can measure it to some degree. You can use some measures to estimate, but it's such a subjective thing. It's not something you can do a blood test to say, okay, yeah, they have X amount of pain. Do you get what I mean? So doing this test and with the findings could provide some reassurance that you've not been lying about things. This is an experience that you've not been imagining. And I think it's really helpful. Guys, this is a breakdown of a deep dive into a report. Like I said, I found it on a public forum. There was a lot of conversation around it, and I felt it would be useful to just come and chat about it with our audience here and help you if you are also about to have a laparoscopy and you're wondering what's going to happen, wondering what kind of questions will be or could be answered by your procedure. Again, I encourage you, of course, to keep asking. please always ask your medical practitioners. They're always happy to engage you with this kind of information. Guys, let's take another quick break, and we're nearly done. I think we've just got 1 or 2 more questions to tackle. But yeah, please let me know what you think, if you're finding this information useful, and I'll see you back in a moment. Feeling unwell but dreading the wait for a doctor's appointment? We get it. Life doesn't stop for health concerns, and neither should you. Your GP consultation connects you to licensed healthcare professionals from the comfort of your own home. No waiting rooms, no hassle. Discuss symptoms, get advice, or manage ongoing care, all through secure video calls and chat. It's healthcare that fits your schedule. From hormonal balance to menstrual health, thyroid concerns, or menopause care, our GPs are here to listen. Get personalized, discreet care that's tailored to your needs. Whether it's a minor illness or just a question that you've got, we're here to help you stay proactive about your health. Your GP consultation, because healthcare. Okay, guys, thank you so much for being with me. What an amazing conversation we're having today. And I hope your Monday is going well. It's good to have these kind of discussions at the start of the week, set ourselves ready for the next few days. And yeah, I'm hoping that wherever you are, your day is going well and that you're being nicely set up for an amazing week ahead. Okay, so we set ourselves a task to cover and address 6 questions. We've done 4 out of 6. I think we're doing very nicely. So we've got 2 more to tackle. We have considered the endometriosis operation report. We've just done that. We've looked at menstrual clots, talked about natural fibroid treatment. We've talked about vulval lumps and bumps. Now, my friends, let us talk about skin tags and diabetes. So I got this really interesting question. And yeah, at first I was just going to write a quick reply, but I just paused. I thought, you know what, it's a really good conversation, and I would really love to have chats with my viewers about metabolic conditions. When I say metabolic conditions, I'm talking about things like diabetes, thyroid disease, that affect women, can affect us at different stages of life, from before pregnancy to being pregnant, and post-menopause and postmenopausally, and so on. So I didn't want to just sort of leave that response just for the person who asked. I thought, let me bring it to the live stream so we can have a conversation around it. So thank you so much for bringing that question in. I don't know if did I write it out? If I wrote it out, then I can just quickly share with you guys. I don't think I wrote it out. I think what I did instead was I just have an image. Let me just share that with you quickly. I have an image of skin tags. So let me just pull that up for you if I can find it. Is it here? Okay, let me see. If I didn't, I might not even have downloaded it. Oh, why didn't I download it? Hold on, guys. Okay, maybe I'll just share the screen. Let me share the screen. I think that'll be quicker than just me trying to download it, and because that will take a while. So let me see if I can share the screen. Skin tags, guys. You know what skin tags? You've heard of skin tags. Is it here? Okay. Let me share. So hopefully you can see this with me. Yep. Okay. So hopefully you can see. Skin tags. What are skin tags? They are tags of skin. So let me pull up the question, or let me read out the question. I don't think I read it out. Let me pull up let me read it out for you. Where is it? This question on skin tags. Yes. So the question was, or is, aren't skin tags a sign of insulin resistance? Very, very short and sweet question. Thank you very much, by the way, for sending this question. I think it's very insightful. And obviously, you've heard some things, and we are now here to talk about it. So the simple answer is yes, there is a link between diabetes, or a situation where there's insulin resistance, and skin tags. However, so there's always a however. So you're absolutely right in saying that skin tags are linked to insulin resistance. But I don't want you to, what I don't want you to go away thinking is that every single time there's a skin tag, oh, it's insulin resistance, oh, it's diabetes. Okay, so there is a link. There are some skin tags that would indicate insulin resistance. So insulin resistance is where your body doesn't respond well to insulin, and insulin is a critical hormone responsible for managing, or one of the hormones responsible for managing blood sugar. And having abnormal insulin resistance is usually the next step to developing type 2 diabetes. And it's also relevant, I was just talking about metabolic conditions. It's also relevant to the condition polycystic ovary syndrome. Okay, so that's why I think it's an important women's health conversation. So what is the connection to skin tags? Well, research suggests that high levels of insulin and related growth factors, those are other hormones involved in metabolizing sugar, they can stimulate the growth of skin and other tissues that lead to the development of skin tags. Now, I was saying, what are skin tags? Well, they are benign, soft growths of the skin. They can happen anywhere in the body, and there might be just one random one, or you might have people that have plenty on the face, under the arm, around the groin, on the back, on the hand. You get what I mean? They can happen anywhere in the body. That's why I put this picture to show you. They can look in different ways. They can be very pigmented, like maybe on my skin, you might have it looking darker. They might be, brownish or pinkish, depending on your skin tone. They might look like a wart. Sometimes there's a bit of, oh, is this a wart? Is this a skin tag? There's that kind of diagnostic uncertainty. So that's why I put this picture up, so that we can have that sort of clarity over what skin tags can look like and why it's important to have your conversation with your doctor. So another important point is that skin tags are very, very, very common. And we think that sometimes they could even be because of friction, maybe clothes or skin rubbing against each other, especially in those areas like the groin or the underarm and so on. Or it could simply be because of your genes, genetics, or it could happen in pregnancy. So there are many reasons why skin tags could develop, not just insulin resistance, but I completely agree with you that there is a link between skin tags and insulin resistance. Okay, so having a single skin tag, I wouldn't panic about it. I wouldn't worry. If you're now all of a sudden developing multiple skin tags, okay, if they just suddenly start growing, you've gone through your 20s, 30s, and all of a sudden you start developing a crop of skin tags out of the blue, I would question that. Or if you're developing other symptoms, so if you're experiencing let me stop sharing now, because I think we have had a lengthy look at this picture. Or if you're developing other symptoms, you're starting to feel unwell, for example, feeling tired, especially after eating, undue fatigue that is not really, commensurate or not in line with the amount of effort you've put in the day, or you start putting on weight, especially around the tummy. Some people might even develop other skin changes, like dark patches underneath this armpit, underneath the skin, in the folds, or even in the groin. That's something called acanthosis nigricans. Or you experience irregular periods, I would recommend it would be a good idea to speak to your doctor. Very, very easy to do a urine glucose test, fasting blood glucose test, or HbA1c to check for diabetes. So again, I want to appreciate the person who sent in this question. Your skin is a very, very good clue, not just for skin problems, but for other things that are going on in the body. And I'm thinking I'm going to be doing a few skin-related videos that sort of point to or suggest something going on in the body. But thank you so much for sending in this question. I thought it was a really interesting one, and thinking about it, I hope other people who consider skin tags, yes, they're quite common, yes, they're mostly benign, but if they sort of appear suddenly, or you have other symptoms, then it's worthwhile having a chat with your doctor. But just have a chat. A simple blood test could exclude things. Excellent. Thank you so much, guys. Like the video. We are now going to our next question. This is the breakthrough bleeding question. So I just put a summary for you here, okay? If you're just joining the stream and you're wondering, what is that QR code? Let me remove my question so I can look at you properly. If you're just joining the stream and you're wondering, what's that QR code? Yes, that QR code is the link to your gpconsultation.com, my private online health information service for video consultations around women's and sexual and reproductive health for UK residents regulated by the CQC. You're welcome to use the link, book a consultation if you want to speak to myself or one of my colleagues about your health. We'll be very happy to support you if you're dealing with a long waiting time to see your GP, or as many women experience, or many people experience. And the service is not just for women, by the way, because I mentioned sexual and reproductive health. If you're a guy and you know, I'm happy, I speak to everyone. You know, if you want to have a chat about something that you're a bit puzzled about, some jargon that you've heard somewhere, you want to get the right information. We're all about tackling misinformation. Please, the service is for you. It will be great to see you and help you address those issues. Okay, let us move on. We're dealing with breakthrough bleeding. I'm going to read out the question. It's a very long one. I couldn't get everything on my screen, so let me read it out to you. But I put that bit on the screen so at least you can follow along as we talk. Okay, so I'm not sharing a window anymore, am I? It says I'm sharing a window. Okay, yeah, we're doing fine. Okay, so this is the question about ongoing bleeding and spotting. It says, I've been on the birth control pill for about 7 years. Over the past few months, I've been experiencing bleeding, spotting. Sometimes it's barely anything, but other times it's like a full-blown period, and I have changes throughout the day. So this is it's really crazy. Your period is just not doing what it's supposed to do. Then they go on to say, I am on the continuous birth control, so I'm skipping pills, but I've been doing that for a while. So she's saying, I don't think it has anything to do with that. But she tells us some more useful information. The bleeding also gets worse with sex, as well as cramps, but I'm using lots of lubricant. My doctor mentioned using silver nitrate to cauterize the bleeding if it's a specific part of my cervix that's bleeding. And so she wants to know, what's anybody else got dealing with this? Anybody else dealt with this? You know, she's concerned. All right, guys, let us tackle this. Let's tackle this. I just want to take this off so I can see you. Let's tackle this. So there are a few issues here, aren't there? I think the main things are irregular bleeding after being on the pill for a long time. What is causing the problem? This is not an unusual scenario. Let's just get something. I think I have an itchy nose. Okay. This is not an unusual scenario. Let me break it down. It's not an unusual scenario, but it's really important to work out what is going on here. That's the first thing I'll say. The fact that it's not unusual doesn't mean I'll ignore it. I really would want to know what has brought it on, what's caused it. And there are a few different reasons. You know, why all of a sudden you've been on the pill for 6 years plus, and all of a sudden, year 7, it starts doing its own thing. Now, even if you've been on the pill, the same pill, for a number of years, and it's been fine for you, you have a monthly bleed, you've never had any issues, your body can still change. There can still be changes. Okay, so what could possibly be responsible? It could have something to do with the lining of your womb. It's just gotten to a point where the lining of your womb, basically what the pill has been doing is just making it thinner and thinner. So it could get to the point where it's become so thin, or the pill has done its job so well. The lining has become so thin that the womb lining just breaks down and then just bleeds unpredictably. So if you just imagine a very thin, thin cracker or thin piece of fabric that you easily just thin piece of tissue that easily just crumbles, it cooled. That may explain what is going on as an effect of being on the pill. So one possibility is the effect of the hormone pill on the womb lining. Now, it doesn't happen in everybody, but it's something that could develop, and it's not because of anything that you've done. It's just a way to explain. It doesn't mean that the pill isn't working or anything. It's just a way to explain what could be the case. Now, when I was trained, one of the first things that we're told was, any woman who comes to you with irregular bleeding, make sure she doesn't have an infection. So it's usually the first thing I think about, so I don't end up forgetting it. So it's nothing. It's just I make sure I think about it, make sure it's not in the way. So if we need to do your swabs or any tests, we just make sure that we are not being caught out by one infection that we didn't think could be possible. So sexually transmitted infections that could lead to PIDs are the culprits here. They could cause irregular bleeding. So that's one other cause. The other thing we have to think about are things like fibroids, polyps, endometriosis. These are things, adenomyosis. These are things that could cause irregular bleeding. Could they have developed, or could they have been hidden while she has been on the pill? It's possible. And for some reason, they are now, either the fibroid has gotten bigger, or there's something else causing these structural changes to the womb to now, or to the area around the womb to now become active. So a polyp, especially a cervical polyp, is a small growth, almost, I would say, almost like a skin tag, but inside the organ on the cervix that can easily bleed. So it can bleed with sex, for instance. You could also have something similar in the womb itself. So you could have a womb polyp, so that's within the body of the womb. Or you could have fibroids that can disrupt the lining of the womb and so affect the way you bleed. And all that can develop, when you're on the pill. I've talked about infection. I also like not to forget looking at your cervical smear, your recent cervical smear, or just checking, depending on your age, have you had your smear recently? So we're thinking about other things like cancer, cervical cancer, womb cancer, things that can cause irregular bleeding. They will also fit into my possible diagnosis in what is going on here. However, after reading this, and again, given the limitations I have, because I don't know this person, I don't know how old they are, I don't know their other medical problems, I don't know what other conditions they might have or what medication they're taking. All I have is what she told us, which I have shared with you in terms of, this is the basics, basically what she's saying. All I have is this, but I'm thinking about another possible cause, something called cervical ectropion, which incidentally, I have a video on that we published last week for some funny reason. Cervical ectropion is also, or used to be known as cervical erosion. Now, it's not erosion in the sense that they taught us geography, where water is washing away topsoil and all those stuff for all you geography buffs. But it's a situation where, and I try to explain it to you, think about your outer lip and your inner lip. Erosion is what happens when the tissue of the inner lip starts to grow outside and you're finding it on the outer lip. Now, that is not a good thing. There's a reason why the tissue on the outer lip feels different to the inner lip. It's a bit tougher, so it can withstand things like the wind, withstand the outside environment, compared to the inner lip, which just has to deal with the inside of our bodies, which has glands and cells to help with keeping the mouth moist and all the other things that it does. So you know that your lip, that you can see where we apply your lipstick, feels different to, if I ask you to touch your inner lip, it feels different. This is exactly what's happening in erosion. There is a part of that cervix that has the inner lip kind of consistency, type of cells, and that is growing outwards. So is this more fragile inner lip that is exposed in the vagina? Okay, and that is what could be responsible for the bleeding. So now I know you're going to ask me, oh, isn't that dangerous? Why is that happening? Oh, that's a bad thing. It's not dangerous. It's actually quite common or not unusual. And one of the things that makes it happen, as far as we understand, is being on the pill. Something else or some other condition where it could happen is in pregnancy. Okay, so we think it may be the effect of the estrogen in these conditions, the pill, being pregnant, it might be, that's why the tissues, the inner lining starts to go outside or outwards. We think it could be as a result of that. But, she mentioned that, it happens after sex, for example. So this may explain it. Now, it's not usually painful, so I haven't been able to explain the cramps. But again, I'm just saying, given the information that we have, we could consider this as possibly one of the reasons or a cause for what is going on. Now, again, it marries with what she mentioned towards the end when she said that, her doctor was talking about silver nitrate to cauterize the bleeding. And that is something that is not unusual, because one of the treatments for a cervical erosion, if we detect that you have cervical erosion, and by the way, some women don't even have symptoms. It may just be something that we see when we're doing your cervical smear. So your nurse is doing the smear and she just observes, okay, you have cervical erosion. Please don't panic. Hopefully she'll explain to you what it means. If she doesn't, or you're still not sure, go and speak to your doctor as well. If you're still worried and they need to send you for more tests, then they can go ahead to do that. But one of the treatments, if it's confirmed cervical erosion, is to cauterize or just burn that area. And I don't mean burn in a drastic way. I just mean applying heat to that area to kill off those cells that are sort of migrating to where they're not supposed to, and create a margin that they won't come beyond. So silver nitrate is one of those things, the chemical compound that's used, a very, very quick procedure that the doctor can use to treat. It's something that you don't have to stay in hospital for, can be done as an outpatient. You can go home straight away. You might experience a bit of a discharge afterwards. So I'm not saying, like I said, we don't make any definitive diagnosis. We don't make any treatments. We just try to explain what is going on. If the bleeding isn't settling down, definitely I would think an ultrasound is warranted. If that's still not providing any information, if we don't have any smears, there are many other tests that could that need to be done. Referral to the gynecologist as well if we don't have any answers. So breakthrough bleeding, which is when you experience bleeding in between your expected bleeds, can happen commonly when you're on the pill. It can happen for very, very innocent, simple reasons, or those that can be treated, but then there could also be serious reasons for them to happen. So, my goodness, we have come to the end. Let me see if we've done a good job. Let me see if we've tackled. Yes, we have tackled. We have achieved our objectives for today. We have tackled skin tags and diabetes, vulval lumps and bumps, natural fibroid treatment, menstrual clots, breakthrough bleeding on the pill, endometriosis reports. I think we have tackled everything that we set out to do today. Thank you so much for being a fantastic audience, for watching. I do hope, in fact, I'm confident that you found this helpful. All I'll ask of you is to like the video, join me again in one of my live streams, watch other videos on the channel that provide health education. Tell a friend that we are doing this work here. Again, I put up my disclaimer. This is not to replace your doctor. This is not this is not for you to skip your doctor's office. Okay, we're sharing health information here. But if you are in the UK and you do need to speak to a doctor about your symptoms, and you want to do that online, we have a private online video consultation service clinic called yourgpconsultation.com that I run, and you can book an appointment. Use the QR code that's showing up on the screen to do that here. Guys, it's left for me to simply say thank you so much for joining me, and I will see you again in another stream. But stay well, enjoy the rest of your week. Take care. Bye-bye. Feeling unwell or dreading the wait for a doctor's appointment? We get it. Life doesn't stop for health concerns, and neither should you. Your GP consultation connects you to licensed healthcare professionals from the comfort of your own home. No waiting rooms, no hassle. Discuss symptoms, get advice, or manage ongoing care, all through secure video calls and chat. It's healthcare that fits your schedule. From hormonal balance to menstrual health, thyroid concerns, or menopause care, our GPs are here to listen. Get personalized, discreet care that's tailored to your needs. Whether it's a minor illness or just a question that you've got, we're here to help you stay proactive about your health. Your GP consultation, because healthcare should work for you. Visit our website to book your consultation today.